Good evening, everyone. I'm Helen Normoyle, co-founder of my Menopause Centre, and thank you so much for joining us for this evening's webinar on menopausal hair loss. Now, as we all know, our hair is hugely tied up with our sense of identity. It makes us feel feminine, it's a demonstration of our culture and our heritage, and there's nothing like it just stepped out of the salon blow dry to give us an instant confidence boost. So that's why it can be so frustrating when hair changes are part and parcel of the menopause and midlife in general, especially a party season around the corner. And as you might be aware, around 70% of midlife women experience thinning hair and hair loss. Hi, Michelle. Hi, Sarah. Thank you for joining us. And thankfully, all is not lost. And I'm really delighted to be joined by trichologist Demi Griffith, who's been helping women overcome hair loss for many years. Demi's worked in the field of hair for over 20 years and has practiced as a trichologist for 5. Now, as ever, if you put any questions that you have into the chat, and as I'm sure you'll appreciate, we won't be able to answer individual specific medical or hair queries, but we can, of course, respond on a broad level. So, Demi, thank you so much. And when you reached out to us, I was absolutely delighted because I had a sneaky feeling that hair would be one of those symptoms that would generate a lot of interest. And we've had a ton of people register for tonight's webinar. Now, when you and I first spoke, you shared a little bit with me about your own personal experience and what motivated you to really get involved in helping women and men manage hair loss. So tell us a little bit about your own personal experience.
Yeah, so I worked as a hairdresser. I qualified as a hairdresser straight from leaving school. When I hit I would say probably my late 20s, I started to notice that the front of my hair was thinning, and I kind of just brushed it under the carpet. You know, being a hairdresser, knew ways to kind of disguise it. But when I got to about 32, it became to a point where I was really conscious. And I just remember sort of standing in front of my mirror, drying my hair and just breaking down into tears because I thought, you know, I was just having a bad hair day on top of the already thinning hair. I just couldn't do anything with it. And I remember just breaking down and my husband coming to me, and it was the first time I'd actually spoken to him about it. And he said, come on, we need to get some help. I already knew about trichology, but vaguely. So I knew that that was the kind of person I needed to see. So I then went to see a trichologist in London on Harley Street. I personally didn't have a great experience in terms of going back sort of several times to see this trichologist and never really getting a specific diagnosis and, you know, being told about what my options were. And I ended up just sort of thinking, okay, I've been back 4 or 5 times. This is, you know, at that point, it was a really costly experience traveling down to London each time. So turned back to my GP and went to see a dermatologist. She kind of had me in the chair really for probably all of 5 minutes, didn't even give me an examination and just said, you're suffering from female pattern hair loss. It's just really unlucky that you're displaying these level of symptoms as young as you are. And that was it. Just the book closed, really. I went just thinking, okay, where do I go from here? Which then just spiraled me into this passion of just finding out more about my condition, but also what I could do to help that. And that just gave me an absolute love of hair loss trichology. And never really thought I could be a trichologist, but just sort of looked into it and thought, actually, I might be able to do this. And yeah, just cutting a long story short, I then found one of the 2 organisations in the UK that train trichologists. And 3 years later, I qualified and just haven't looked back since. It's just the most rewarding, incredible job, and I just love it.
And speaking from your own personal experience then, Demi, have you been able to help yourself and get the help you need to manage your own hair loss that you're experiencing?
To a point, yes. For me, because I did brush it under the carpet from an early age and left it quite, you know, a lot of years before getting help, my condition was quite advanced. So with female pattern hair loss being a more permanent type of hair loss, once the hair follicles die, there's nothing we can do with treatment to bring those back. So unfortunately, mine was a little bit more advanced. So I do some treatments on myself, which help a little bit, but, you know, there was only a certain level I could go to with that. So I actually wear a hair topper now. So as you can see, it's just a little topper that sits on the top of my head, but just those, you know, points to where hair loss becomes to a level where we can't really treat. These are a great idea. But yeah, I take all my supplements and I do some treatments that do help massively.
Oh, brilliant. And we're going to come back to that. And to be honest, Demi, I wasn't aware of. Apologies if I ask a ton of dumb questions this evening, but this isn't my area of expertise and I'm super curious. And we've already got a great question in. which I think we can weave into. I'm sure you'll cover this if you look in the Q&A. So thank you very much, Esme, for submitting that question. So I think we can cover that as we talk about hair growth and how it works. So I thought it'd be good if we started off with getting and understanding the basics, the science around how the hair in our head, something that we totally take for granted, how it actually works, and then we can get into the causes of hair loss then. So can you, in layman's terms, Demi, explain how the hair growth cycle works? And if you'd like me, Demi's done a brilliant blog for us. I'll paste that and put it into the chat in a moment as well. If you'd like me to pull up any of the images from that, Demi, just let me know.
No, that's fine. Yeah, so just like I say, just in a nutshell, I'll just talk you through the hair growth cycle. So there are 4 main stages to a hair growth cycle. We have the anagen phase, which is the active growing phase. So this is where the cells rapidly divide, and this lasts about 2 to 6 years. Then the hair moves into the catagen phase, which is what we call the transitional phase. So this is where the hair actually cuts off from the blood supply, and this lasts around 10 to 14 days. Then we have the telogen phase, which is the resting phase. So the hair just sits in the follicle, doesn't really do anything, rest there for about 4 to 6 weeks. Then we go into the exogen phase, which is actually the release phase, where the hair actually sheds and then the cycle begins again.
Excellent. So thank you. So we've got 4 stages of growth for the hair then. And then what are the things what's going on in our body as we go through menopause then? How are our hormones impacting our hair growth?
So it impacts in different ways, Helen, because what we look at when it comes to hormones is estrogen really being the hair-friendly hormone. And it does different things. It helps to kind of elongate the hair growth cycle. So when we see sort of ladies that experience a little bit more shedding, that's because estrogen obviously depletes. So that affects the hair growth cycle. So there's a slight kind of disruption and disturbance to the normal cycle. But most importantly, estrogen is sort of a follicle protectant, and it protects from testosterone. So if you have the hereditary predisposition for female pattern hair loss, a lot of ladies find that they don't have any signs or symptoms until they head into the menopause, because estrogen depletes, which then means that the testosterone is more prevalent. And that particular condition, female pattern hair loss, is an androgen-driven condition. So when the testosterone is more prevalent, it triggers that condition. But that's only if you have that gene and you have that genetic predisposition.
Brilliant. Thank you. That's really helpful, because it's one of those things, isn't it? You know, because you notice the change in hormones. If you've had children, you notice how thick and lush your hair becomes, you know, when you're pregnant. And then I found certainly when I stopped breastfeeding, my hair really just started falling out, I think, as my hormones started to settle down again. And I've really noticed the difference now as well going through menopause, that I feel, you know, my hair is coming out. I know my hair looks thick, but trust me, it really was a lot thicker than this before as well. And I can feel, you know, certain parts of my head, my hair thinning as well, which I think, as we were discussing before our live, that's what you also see, that pattern of hair loss as well.
Yeah, and there's, like you said, there's a connection with being pregnant in terms of estrogen levels, you know, are in abundance. And you notice that, you know, your nails probably grow much faster, but also your hair can be much more, you know, sort of bouncy and feel a lot thicker and get a lot faster growth. And then obviously postpartum, those estrogen levels kind of drop. And again, similar with the menopause, when they deplete, and then that has that change. So yeah, there's definitely a similarity there.
Brilliant. And then, so I think we've covered Esme's question there about the role of testosterone and why her GP might be holding off prescribing it. So Demi, it would be really great now if we could cover the different types of hair loss that you come across.
Yeah, so really there's 2 main types of, 2 main hair loss conditions that I see that are connected to the menopause. The first one being a condition called telogen effluvium. Telogen effluvium is a more temporary form of hair loss, where you basically see the hair prematurely pushed into the shedding phase of the cycle. So it's a disturbance to the hair growth cycle, as I mentioned, with estrogen helping to kind of elongate the hair growth cycle. So with telogen effluvium, the hair's prematurely pushed into the shedding phase of the cycle, and generally we normally see around 10% of the hairs on the head that are in that kind of telogen exogen phase of the hair cycles. So we generally lose around 50 to 100 hairs a day, which is perfectly normal. But when the hair's prematurely pushed, more hairs are prematurely pushed into those phases, then you can physically see much more hair coming away than you would normally. So excessive shedding, and that it can be telogen effluvium. There can be other causes to telogen effluvium. It's not solely connected to the menopause. So that's why we look at blood sort of levels, so checking vitamin levels, thyroid as well. Stress can be a factor, and anxiety obviously comes along with the menopause as well. We know that. But the start and stop of medications and any hormone fluctuation, so that can include the menopause, but it can also include the start and stop of contraception pills and some HRTs as well. So yeah, that's the kind of temporary form of hair loss connected. The slightly more permanent type of hair loss is, as I've mentioned, the female pattern hair loss. So this is a hereditary condition. So it's a gene that you're born with, which is responsible for the conversion of testosterone to a more potent form of, which is called dihydrotestosterone. And this attacks the hair follicle and causes miniaturization. So in general, the hair growth cycle generally works as normal, but this is a much more slower progressing condition where over time, I mean, any hair follicle can produce between sort of 1 to 4 hairs. So over time, that is reduced, and then the hair follicle itself starts to actually shrink and miniaturize. So those hairs become much finer. It would only affect that sort of top androgen area of the scalp, so generally sort of front, temple areas, going across here towards the crown as well. They're the most sort of affected areas there. But like I say, it's much more slow progressing condition, but it is a permanent type of hair loss because it does result in follicle death.
And then I know we're going to come on to now the different approaches that you can take to managing hair loss, but I think in general, so I've just pasted the link to the symptom checker on our website and hair loss, because it's probably worth saying before we get into your specific treatments, Demi, in general, there are things that one can do to improve one's overall well-being that will help with hair as well. So exercise, stopping smoking, eating a healthy diet, some supplements, which we might come to. But if we say that's a given and that's a backdrop, if we could get into, and I know you've got some pictures that you're going to share with us as well, maybe just take us through some case studies of the different types of hair loss you've come across in your clinic and the different approaches and the advice, because obviously what you do is tailored to everyone individually, because everybody's, lifestyle, what's driving their hair loss will be different. So maybe let's just go through some case studies, Demi.
Yeah, definitely. And I'll pull up some images to show you some sort of before and after with treatments and things. But yeah, like you say, it is important to, and with my patients, if they're suffering from female pattern hair loss that has been triggered by the menopause, and like myself, some people can actually see the effects of that way before the menopause, but then it can be kind of driven along a bit more severely during the menopause, or it's just triggered by the menopause. But it's important to look at a cover all basis as well, because if somebody has that diagnosis and then is going to invest time and money into treatments, if we then don't check, say, their nutrient levels and they have a deficiency that's also contributing, it's kind of counterproductive. So it is important to check all of those bases as well. So like you say, just general well-being, really. Diet has a massive, massive impact on the hair growth cycle. It really does. I think people underestimate how much. So it's really important to kind of look at your diet, your alcohol levels, your exercise, but also be having a really good tailored supplement plan as well, which will help. So shall I pull up some of my images and talk through some of the treatment options?
Yeah, I find them so helpful just to see the before and after.
Yeah, okay, no problem. Let's do that. Bear with me 1 second.
And we've had a few more questions come in, Demi. So thank you for those questions, folks. And we'll pick up on those as well after Demi has taken us through her case studies. And Demi, you may or may cover this, may not cover this as we go through, but one question from Julie is if you could cover FFA.
Frontal fibrosis and alopecia. Yeah, so yeah, I can touch on that as well. So it's a slightly
as
different,
you're going through.
Type of hair loss. So it's generally not caused by the menopause, but it generally affects postmenopausal ladies. It's more of an autoimmune condition. But yeah, I'm happy to touch on that as well. Okay, I'm just going to share my screen and then we can see some images there. Okay, have we got that?
Yep.
Yeah. Okay, so what I'm going to do, I've got a folder with lots of different before and after pictures, but I'm just going to try and sort of pick out some key ones that I think are a little bit more relevant. So this is a lady that actually does suffer with female pattern hair loss. As you can see on the first image, her parting was kind of quite wide, and that's one of the key kind of things to look out for with female pattern hair loss. It can affect the temple area, so you can get sort of temporal recession, and a lot of ladies do suffer with issues on the temples. Sometimes not always hair loss, and I'll show you a couple of images, but sometimes just that they get really lots of shorter hairs there that just never really grow to any significant length. But the kind of key symptom is that widening of the parting and just seeing that top area of the scalp become more visible over time. This was one of the treatments that I do in my clinic, which is calcium microneedling. Microneedling is a device that houses 12 superfine needles that superficially puncture the scalp, causing microchannels. And I microneedle the calcium serum into the scalp. Calcium serum is stem cell technology. It's just an incredible treatment. Generally with microneedling, as some people might know because they might have that on their face as a treatment, you generally have a treatment once a month because the scalp needs to go through the full wound healing process, which actually takes 4 weeks. With calcium, the wound healing properties in that serum are just super duper, and it enables the scalp to heal much more quickly, which means that you have a treatment once a week for either 6 or 12 weeks. So in effect, this gives the quickest results because you get 6 months worth of results really in 6 weeks. So it's a phenomenal treatment. I have a 100% success rate in clinic with this treatment as well. And some of these images are microneedling solely, but I'll talk through a few as well that are kind of combined therapy. So once I've gone through somebody's medical history and obviously their condition, the extent of their condition, there's lots of things that are taken into consideration before I put treatments on the table because I need to look at all of that information. So combined therapy is obviously going to give you the best chance of result and the best results. But some people, for whatever reason, just decide to go with one option. But yeah, this lady just had the microneedling, and in 6 weeks, you can see that her parting started to thicken up and fill out.
Yeah. And Demi, are these results permanent, or do you need to come back for top-up treatments when you take this approach?
Yeah, so when we're looking at female pattern hair loss, we're looking at long-term treatment because it's a permanent type of hair loss. So yes, initially you can kind of boost with, like the 6-week treatment, but then you would go on to maintenance. So every 3 months, then you would need a top-up. The same with other types of treatments like the laser, which is a good option for that condition, or minoxidil, which is first-line treatment for female pattern hair loss. It is looked at as a commitment and a permanent, treatment plan moving forward. Okay, so I'm just going to skip through a few of these. So just to find, so that lady has female pattern hair loss, and you can see that in 12 weeks, the increase in density on that top area of her scalp, which was incredible. Now this lady, going back to the temple areas, she just found that around her front hairline, she had hair there, but it was just baby hair that just didn't grow to any significant length. This lady had 12 weeks of the calcium microneedling, and we were able to get some really nice growth on those, and that was in 12 weeks. Some really nice sort of length on those temple areas. This lady here, you can see here again around the front hairline, and in just 6 weeks, all of that new hair started to grow through on the front hairline. So really pleased with that. There's just one other lady I want to show that that did a sort of combined therapy. Again, there you can see temple areas. Bear with me while I just flick through some of these. This lady here. So this lady did a mixture of combined therapy. Now this lady just wanted to kind of just go all in and get the absolute best results possible. So she uses the Theradome laser helmet, which is low-level laser therapy. She uses that at home 3 to 4 times a week. She uses minoxidil daily, and then she also had the calcium microneedling. This was in 3 months. Obviously, this is female pattern hair loss, again, just affecting that top area of the scalp, and the density just increased incredibly. So yeah, you can see on the crown area there, it just filled out really, really lovely. So yeah, that just gives you sort of an idea of, the type of results that we can get with some treatment options. But everybody's different. And I know we talked about this, didn't we, Helen, in terms of
Yeah.
people responding to treatments. And a common question is, how long will it take me to see new growth? But it's really individualized, and some people can respond really quickly, but other patients can be a bit more slower responding. So sometimes patience is, and it's frustrating because we want results really quickly, but yeah, you have to be patient.
Yeah, and we've got a great question from Miriam here, which and Tracy, we will come back to your question as well, but we discussed this in the prep as well, Demi. So if you could just kind of talk us through what happens when somebody comes to see you, the different steps and the costs associated then with the diagnosis, and then with the different approaches to treatment.
Yeah, so an initial consultation is kind of the first step in that you would have an appointment in clinic. A consultation takes around an hour, so you're in clinic for around an hour. That involves me taking all of your information in terms of medical history, medications, the supplements you're taking, your hair care routine, and we look at the symptoms you're having. You then have a full examination. That means that I can sometimes take hair samples, have a look at them microscopically. I have a look using a dermoscope at the scalp, so that lets me look at the scalp and the hair follicles under magnification. And then that enables me to give a patient a specific diagnosis. That would then be fully explained, and then based on me looking at sort of any contraindications, such as medical history or medications, I can then sort of put to that patient what treatment options I think would work for them and what their options are. But then you also get further advice. So we look at diet, obviously blood test results, and I can give a tailored supplement plan, hair care routine, so we can look at all of that. So it's quite inclusive, and there's a lot of information you do get from a consultation within that hour. So yeah, a lot of people do say to me that the one thing they're blown away by is how much knowledge they come away with. Yeah, so, and I'm easily accessible as well afterwards. So any questions that anybody does have after a consultation, I'm always accessible by the telephone or email to answer those as well.
Yeah, no, brilliant. And then so 199 for the initial 1 hour consultation, and then you give people a recommended treatment plan. So the different types, you talked about how some people only went down one route, others took a combined approach. If you just give, I know you can't give precise costs because everyone's different, but just so people listening in this evening have a sense of the ballpark range of costs.
Yeah, so I suppose we started at bottom range, minoxidil. So a bottle of minoxidil that you would use daily. It's a topical lotion that you apply to the scalp. One bottle lasts around 2 months, and starting price is £48. So £48 to £59 for minoxidil. Another option is the laser therapy. So a lot of clinics offer in-clinic laser therapy, where you go into clinic a couple of times a week and have the laser treatment in clinic. For me, that just means that it's working out far more costly to the patient. And the Theradome laser helmet, and I've researched, there's a lot of laser options on the market. The Theradome is by far the best, but it means that you can just purchase the helmet and do the treatment at home. So it just slots into your routine really easily. That's yours to use then for as many years moving forward as that device is in good working order. The cost for that is £899. And then we've got, I suppose, more top end is the microneedling, which is the stem cell technology. So on average, we're looking at a 6-week block, which is me doing 6 treatments with all your serums, about an hour and a half each treatment. So for those six weekly treatments, you're looking at 1,450. It is the more expensive one, but like I say, I get 100% success rate. It gives incredible results, and it gives very, very fast results. So it's quite a popular treatment for that reason.
Okay. Yeah, so good. So that's a whole range of options that you've outlined there as well for, in terms of affordability for
and
people.
sometimes as well, it's not always about going down the route of doing those specific treatments. And for somebody that can just be suffering from telogen effluvium, say, which is just the disturbance to the cycle and shedding, that could just be predominantly caused by nutrient deficiencies. So a lot of the time, we can also look at a supplement plan as being a treatment as well.
Yeah, so it really just shows the benefit of having a consultation, just to talk it through and to really understand what's going on. And we're going to come back to everybody's questions, but before we do, I thought a good practical question, Demi, would be: what are your top tips in terms of finding a good trichologist?
So always make sure that any trichologist you go to is with a registered organisation. There are 2 main organisations, and you can actually go onto their website, and they have kind of a search sort of ability on there to be able to tell you where the sort of registered trichologists are in your area. So there's the Association of Registered Trichologists, and there's also the organisation that I'm registered with, which is a World Trichology Society. And it's just, you just go onto their website and it's sort of Find My Trichologist, and you can put your location in and they will tell you where the closest ones are to you. But just always make sure that they are properly qualified and they are registered with an organisation as well.
Okay, brilliant, Demi. Thank you. Now, so if we, I'm going to fire out a few questions to you. I don't know if you can see them in the Q&A and the chat.
Yeah, there was
But
just
if we,
one that I did want to touch on, because I know that, so Sarah Mulligan has asked about increasing estrogen dose in HRT to help reduce hair loss. And obviously that kind of might come under the category of treatments. So I thought that'd be a good one to kind of answer as well, in that HRT for me isn't, from a trichologist point of view, isn't looked at as a hair loss treatment. It can help in some cases, don't get me wrong, but really HRT, you know, as you know, Helen, when it comes to estrogen, it won't raise your estrogen levels to where they were pre-menopause. So it kind of just takes you know, it looks at taking the edge off symptoms, but it's not actually looked at as a specific hair loss treatment. But it is important to find the right balance in terms of, if you have been diagnosed with female pattern hair loss, then a more testosterone driven HRT is probably not going to be the best one for you. So it's always worth working with your menopause specialist, your GP, and telling them about your hair loss issues and your diagnosis so they're aware of that. That's really important.
yeah, I agree, Demi. And then so, and thank you for that question and for that response. And you cover that off on your blog as well. And in the symptom checker link on hair changes, you can see what Dr. Claire says about that as well there. So we've got lots of questions coming in. We've got about 2 minutes to go. So this would be like a mastermind, Demi. This is your specialist
Oh,
subject.
away, I'm ready.
We need the spotlight now. Okay. So where do we start? So Tracy has been waiting quite a while. I think her question has been in the longest. So Tracy's question was, she's been advised not to use conditioner on her hair as it can make you lose more strands. What are your thoughts on that? And any recommendations of shampoo brands to help with thickening hair?
Okay, so shampoos and conditioners won't have any bearing on your hair loss whatsoever. There's really no such thing as a harmful shampoo or conditioner. In terms of shampoo, we all know that there's all that out there that tells you not to use SLS, parabens, but they're really not harmful because there's such small amounts in these products. If they were, they wouldn't be able to put them in shampoos. It's only if you have a particular sensitivity that it might give you a bit of an itchy head and a bit of irritation, but apart from that, it's not going to be harmful. In terms of the conditioner, to answer your question, you should use conditioner. Shampooing is about cleansing your scalp. Conditioner is about hydrating your hair. So, you know, hair needs to be hydrated, because if it's not, it's going to become brittle and you're going to end up with breakage. Sometimes you might see, if you do use a conditioner that makes your hair sort of super sort of soft, you can see that if some hairs are shedding, you might see them just come away a bit more easily. But that's not the conditioner causing that. They're going to shed anyway. So yeah, you shouldn't worry about that. And yeah, use conditioner if you need to, definitely.
Brilliant. And any particular brands that you'd recommend, Demi, for thickening one's hair?
I always recommend, in general, for anybody that doesn't have any scalp issues, Philip Kingsley products. I've tried and tested so many different ones on the market, and sometimes you can find a brand that has just one product that's good or one conditioner that's good. I wanted something that was good across the board. Philip Kingsley are products that are made by trichologists. They're really well formulated and they're just good products all around. So that's my kind of top brand to go to, definitely.
Brilliant. Thank you, Demi. From Joe, question here, is temporal hair loss hormone related? And if it is it reversible?
Hair loss isn't always hormone related. Some people can find, if they're suffering from telogen effluvia and having that shedding, because the hair is always a little bit finer around the front hairline, sometimes the temple just show that loss a little bit more significantly than anywhere else on the scalp. Obviously, if it's due to female pattern hair loss, then yes, that is hormonal. Rule of thumb, if you have follicles, which a trichologist will be able to determine by your examination, if there are follicles there, we can work with them. If they're empty, dormant, just need a kick up the bum for want of a better expression, or they are miniaturized, treatment can help. It's only when a follicle has died and there isn't a follicle there, we can't bring that back with treatment.
Brilliant. Thank you, Demi. That was very clear. Great question from Gail. I'm really glad she asked this. Can you explain more about the little hair topper? Where to get it and what does it cost? It looks so brilliant, she says.
Oh, thank you, Gail. Yeah, so mine is just a topper. So you can get some toppers that are sort of more silicone based. They're kind of a circular. These are the most generic ones and most widely sold ones, but they have 5 clips. Now, for me, the little clips are fine if they're just every now and again, but my main hair loss is just at the front here. And you found with those particular toppers, the clips go round. There's 5 clips, and there's one that sits right here. Now, it's just obvious to me, you're not going to put a clip into an area that is thin in the way you're going to put more tension and more stress on that area. So I wanted to find something that was a bit more bespoke to me. So unfortunately, this is something I have made myself. So yeah, it's not something that's kind of easily available. I just kind of, with my hairdressing skills, I colour it to match, you know, all of this under here. As you can see, that's all my natural hair, and it's just the top piece, the 2 clips that attach just behind the ear.
It looks so amazing. I'm going to ask the question that I'm sure everyone's thinking is, can you make them for your clients?
It was something that I did think about doing, but to be honest with you, it's just so time consuming. But yeah, there are some good companies out there, and in particular, there's a company called Glamour Hair London, and Nikem is incredible. I actually buy my hair from her, but I obviously colour it myself. But she's phenomenal, and for wigs, her wigs are absolutely incredible, and she does do frontals and toppers as well. So she would be my recommendation if you were looking for
So
something.
Demi, any of the brands or companies that you're mentioning, if you could send me the links, and then I'll add the links, because I should have said this is being recorded. We'll send the recording out, but I'll send the links out with the recording as well, so people have them to hand. Then we are going to have to wrap up, so I'm just going to, hopefully we'll get through the questions that are in here. Another really good question here from Esme. So is there a blood test, Demi, or some way of determining if you have the genetic version of hair loss, or would it just go on physical examinations?
So generally, I just go, you can just tell by a physical examination. So it's very apparent in the way that a certain hair loss presents itself, and obviously by me looking at the hair follicles. So I determine that and give a specific diagnosis based on an examination. You can do what's called a tricho test. I don't offer it in my clinic personally, because I think it's a little bit overpriced and I don't see it's that effective, but some trichologists do use it. It's called tricho test, and you can have a swab, it's a mouth swab, and it basically tells you not so much a diagnosis, but it tells you what treatments are more likely to work for you. So that's one test you can have. But yes, bloods can be checked, and your estrogen, your testosterone can be checked, you know, levels, but it's really more about examination.
Yeah, and I know in terms of blood tests with estrogen, certainly the challenge is your levels can fluctuate so much day to day. So again, I think if you're looking at something like that, it's always good to talk to your GP or menopause specialist. I'm just going to close out on the last few questions that we have. I think, Demi, we're going to have to do another session with you in the new year. We've got so many questions still coming in. I apologize. I don't think we're going to get to them all, but I'll take the ones that people have asked a good few minutes ago. So Anne, thank you for your question. Anne's GP has referred you to a dermatologist, Demi. Will the dermatologist prescribe some tablet that increases hair growth? Do you have any thoughts on what the dermatologist might do, or is that just Anne will just need to wait and see what happens when she gets there?
Yeah, so a dermatologist is generally the person that is the only person a GP can actually refer you to, because trichology is not on the NHS. Dermatologist is a skin specialist. They're incredible in their field, but they do generally only have limited knowledge on hair loss. Sometimes I do have to work closely with dermatologists, because unfortunately at the moment trichologists don't have the power to prescribe. So in terms of prescription medications, so steroids, things like that, I do sometimes have to push to a dermatologist for intralesional, so steroid injections, things like that, or for scalp biopsy. So yes, sometimes they can be needed, but I would say always see a trichologist first, then they will tell you if needed to go to a dermatologist, but it's only really kind of rare cases, really.
Brilliant, thank you. And that was really helpful. So Diane, you'll be pleased to know we're coming to your question now, because you got in before we were due to finish. And a great question from Julia that Diane has called out as well. Does collagen help with hair loss?
Yes, it's a really good supplement in addition to a supplement plan. So I generally don't recommend supplements until I've seen blood test results, because we know, yes, deficiencies, low levels can affect the hair growth, the cycle. But also, if I were to recommend something to you and you were already at the top end of the kind of level with that, that would then take you out of range and be too high. So it's important to look at blood results. I look at them very differently to a GP, because I'm looking, specifically for the range, which does actually change, which is for optimal hair growth. But collagen is a great addition. I recommend to my patients Absolute Collagen. It's just a really sort of high dosage, pure form of collagen, and the amino acids, really great for helping sort of with the hair growth cycle and with the hair condition as well. Most people say their hair feels much more sort of soft and supple using a collagen supplement.
So you and your patients are seeing the benefits of taking it.
Yeah, I mean, we all know it's incredible for skin, but yeah, for hair as well, definitely. It's definitely a good addition.
Last couple of questions then, and I'll give them to you all together, Demi, in case there's a thread coming through and you can tie it up, because we will need to finish then. So great question here on what are the best foods, supplements to support healthy hair. If you have scalp issues, what would be a good shampoo or conditioner? And then there's a thank you, Angie, a very general question here from Angie about your experience of different hair types. So from curly, tight, coiled, or afro hair, and do you get different results depending on the hair type?
You can, yeah. And I would always say to somebody that is of African descent or has Afro-Caribbean hair, see a trichologist that specialises in that. I don't personally, because it is very different. So I would, that would be another, recommendation to see a trichologist that specialises in that area. So in terms of shampoo and conditioners for the scalp, conditioner really shouldn't be reaching the scalp. It's really just for the mid-lengths and ends of the hair. You don't need to put conditioner on the scalp. It doesn't really do anything. In terms of shampoo, depends on what type of scalp condition you're suffering from. It's a difficult question to answer really without knowing, because there are lots of different scalp conditions. Yeah.
Brilliant. Thank you. And then the last one is very quickly, best foods or supplements in your view to support healthy hair.
Again, with supplements, I don't recommend until, apart from collagen, that can be good for everybody, but I don't recommend until I've seen blood test results. And in terms of food, it's really back to basics. It's, dead simple in terms of as much fresh kind of food, just a good balanced diet, lots of protein. I say try and get protein in with every meal, but your fruit, your veg, keep your water intake really high, and just keep things like refined sugar, processed foods to, a minimum as much as you can. That's really that's a really generalized kind of piece of advice. Obviously, I can go more into that. I could sit here and talk all day.
very, very sensible. So good quality protein, leafy greens, fresh fruit, minimize processed foods, minimize sugar, probably really cut down alcohol. If you can, give up smoking if you do smoke. So probably all of those things will make a difference.
Yeah, and all those things can affect the scalp as well. So a lot of scalp conditions can be exacerbated by high dairy, processed foods, and high refined sugar as well.
Yeah, brilliant. Right, we're well over time, but I think that shows the level of interest, Demi, and all the questions that came your way. Thank you so much. I really appreciate you taking the time this evening. I know you've been at work all day. Thank you, everyone, for joining us, and thank you for all of the brilliant questions. I think everyone will have benefited from the questions that you asked and hearing the responses. So wishing you all a lovely evening, and if I don't see you before Christmas, have a lovely time over the Christmas holidays. Take care. Thank you. Bye-bye.
Thank you, everyone. Bye. Take care.